Ever get confused between PaO2 and PaCO2 on an arterial blood gas result? While they both measure gases in the blood, they tell very different stories about your patient's status. PaO2 reflects the actual oxygen levels dissolved in arterial blood. PaCO2 measures the pressure of carbon dioxide, showing how effectively the lungs are clearing waste. Let's break down the clinical link to physiology. A low PaO2 indicates an oxygenation problem, meaning the lungs aren't getting enough oxygen into the bloodstream. Conversely, a high PaCO2 signals a ventilation problem, where the body isn't breathing adequately to exhale CO2. One is about intake, while the other is about waste removal. As a nurse, your interventions change based on these values. For low PaO2, you might increase supplemental oxygen or titrate flow. For high PaCO2, you focus on improving ventilation through repositioning, suctioning, or mechanical support. Always remember, PaO2 is for oxygen and PaCO2 is for ventilation.